country of the 11 countries that have provided health care for all has done it has been a single-payer system, a national health care plan with a single-payer system at its base. There are some countries that allow, on top of that, a private health insurance. Like France is bifurcated. They have a basic single-payer system, like plus you can have insurance on top of that if you want.
Provinces like Canada.
And they're starting to move that way in Canada. It's very debated. I think it's a mistake, actually, but that's where they're thinking about going. And what's interesting about the countries that do have health care for all is they have longer lifespans and they have healthier lives than we do. All the research shows that. Even the British system, as screwed up as it is, they're doing better than we are. We spend more per capita than any other country in the world, more per person than any other country in the world in healthcare. Yet 50 million, almost 50 million people don't have health care. Over a 2-year period, about 80 million people don't have health care for a 6-month period in the United States. And we're spending more than any other country in the world. And the reason why the single-payer system is the only way that gets you there, because it's the only way you can afford to get there. Right now, the private health insurance overhead and bureaucracy takes up 25 to 30% of the cost of health care. And for a typical doctor's office, it's 42% of their overhead just trying to get paid from the health insurance industry. More and more doctors are moving toward no health insurance, pay as you go. Come in and give me a check because the health insurance has gotten such a burden. That may reduce some of the costs, but a lot of people just can't afford to deal with that. That's just not going to work for some people. And so the only way you can really get to a health care for all is a single-payer system. That's just all that. I've looked at other alternatives. The ideas of that are put out about having a health account, you know, that helps people who have the money to have a health account. But the problem are the people who can't afford that. And if you so a lot of Democrats now are talking about universal health care, but they don't talk about single-payer health care.
How does that work? How does this
universal health care is
how does the one that you're for?
The single-payer is a national. It's kind of like a Medicare for all. Essentially, the government becomes the insurer, and it's a national health care plan. And you're allowed to. The way I would put, you have 2 choices in that. You can do like the British Health Service, where the doctors work for the government. I'm not advocating that. I'm not advocating. Oh, that's better than ours. I'm not advocating that. Or you can do a system where the doctors and hospitals remain as they are private. And what's interesting about that is, if you take that approach and you have a single-payer system, it creates great competition among doctors. And the competition is not over cost anymore, it's over quality of care. And so it creates this kind of self-fulfilling quality control, because you're competing over quality. And so it actually improves the quality of healthcare as well when you take that approach. Yeah.
What percentage of U.S. healthcare costs is actually insurance overhead?
25 to 30%.
So you cut that out, then
you cut that's about 200, and according to Medicare is 3%.
And 10 to 15% of that is screening of keeping people to find people that they don't want to insure.
You mean the gatekeepers, right?
Right, so that they find the people that they want to keep in the insurance program and getting all those other people out that they don't want in there. So it's,
it's the way the whole system.
You pay for that every time your company pays for health insurance, or you pay for health insurance. You pay for those health insurance companies to screen out other people from ever getting health insurance.
Steve is, by the way, running for Congress against Steny Hoyer. One of the first things I met Steve on was, I think he sent me a paper on healthcare. Right?
Yeah, I sent you
that you had written. It was very similar to my kind of stuff, and I saw it immediately because he had the right issue on healthcare. And the other thing about a couple things. The other alternative single payer is multi-payer, which means private insurance companies, and that's essentially what they're doing in Massachusetts. Is a multi-payer approach where people are forced to buy health insurance.
That's wrong.
You have to have health insurance. You know, to me that's even worse. That empowers these corrupt insurance companies that are filled with bureaucracy, overhead, and bloated CEO salaries.
Totally agree.
And so, you know, that's the worst approach, I think. And so, if you want to have health care for all, those are really the 2 choices. And so, I'm an advocate of the single-payer approach because I think it's much more efficient. And the other thing about the single-payer system is it breaks the connection between employment and health care, which is critical. Right now you have a situation, we have really a socialized situation right now, where the government gives tax breaks to employers, gives business to the private insurance industry, protects the private insurance industry, and so essentially it's government, you know, working with the private health insurance industry employers, and so it's kind of really a socialist system in many ways. or actually more of a fascist,
fascist.
more of a fascist system.
Fascist.
That's more of a fascist system, combination of government and big business. And so, even for libertarians, socialism is better than fascism.
Yeah.
What's the difference?
But breaking the employment connection is really important for a couple of reasons. First off, it allows U.S. companies to compete worldwide. You know, take a foresting company in Maine. They are competing with Canada, and the foresting companies in Canada don't have to pay for health care. And in Maine, the foresting companies have an uncontrollable cost. You can't predict the health care cost. It's one of the most rapidly rising costs, and so it makes hiring employees risky. And so it really hurts employees as well, because employees then employers are less likely to hire new people because I can't take on another health care. Who knows where that's going to go, and I just can't afford to take that risk, and so they don't hire people. So it really undercuts employment as well, so it's not good for employees. So it's not good for employers, not good for employees, it's not good for consumers, the current approach, because you can't pick your own health care. I mean, you're told by the insurance company, you go to this doctor, and no, you can't have that approach. But in a single-payer system, you can pick your approach. You go to your own doctor you want to pick, one you like, that you relate to best, has the best quality, whatever it is about you like.
Like a voucher system, really, isn't it?
Kind of, it could be. That's one way of doing it. I mean, there are a number of ways to do it, but that's one way of doing it. One way of doing it is you can create a healthcare fund. Everybody pays in the healthcare fund, and you all get like a debit card, and you go into the doctor.
Which is actually being done already.
For
With the medical dental savings
medical
account. I have
dental,
one
yeah.
right here in my wallet.
oh, for done privately.
Yeah.
Not done
yeah,
through the government.
But they do have a
right.
debit.
That's right. That's right. You can do it that way. So anyway, that's the. And so what's interesting about what's great about the healthcare issue for me is it's an issue that highlights how our government is essentially selling the country to the highest bidder. If you look at OpenSecrets.org and see how much money the health insurance industry gives both parties, you see, millions of dollars going to both political parties. OpenSecrets.org tracks money into politics. So if you want to look at put Cardin in, and you'll see that he's one of the top 20 recipients of hard right Israeli money. That he's one of the big recipient of health insurance money, pharmaceutical money, defense contractor money. So you can check every candidate and see where they get their money from, or every political party, or every industry gets how much they give. And so it's a really great resource. What you find is that we get a lot of money from the health insurance industry to both political parties. And as a result, neither political party is going to challenge the health insurance industry. Similarly, with the pharmaceutical industry, a lot of money comes in. The United States pays 3 times as much as other countries for the drugs we get for pharmaceuticals. Why? Because they're selling the country to the highest bidder. The pharmaceutical companies give money to the politicians, and they can price gouge the consumers. And on top of that, in the pharmaceutical area, we provide the money for the research through NIH.
That's the worst part.
We provide the corporate welfare to get the research done.
Yeah, yeah.
Then we provide the protection in the courts to keep their monopoly. Then we allow them to price gouge.
Well,
It's crazy.
Everybody's in the same bed, but when it comes to the drug companies, also you got to realize that the FDA actually is the promoter of all of this. I mean, you could have a more free market approach to see what drugs work, as long as you have truth in advertising in what you're selling.
That would be a help.
But that is not happening.
That would be a help.
When it comes to your views on healthcare, that is actually the big stickler between
Being libertarians
and so forth.
That's right.
I do agree with you.
You can keep going.
We agree with the problems. I don't think there's no problem there. We agree with the problems. It's a question of how we're going to overcome the problems.
And the reason why a free market approach would not work in healthcare,
According to your opinion.
the reason why a free market approach won't work in healthcare, you can see it in the way we handle malpractice insurance, is because what the insurance companies will do is they segment the market. And so the people who have low risk, people who are 20 to 40, who have no long-term or chronic illnesses, they get health insurance. Kids, elderly, chronically ill, they won't be able to afford health insurance. And so that's why a free market approach won't work, is what they'll do is they'll segment it and they'll take advantage of
The question that I have
people.
on that is this. Is that actually free market, or is that part of the mercantilism and fascism in economics?
Well,
That is my
that's part. I think it's free market to
That-
allow a corporation to set the price. That's free market. And that's what they would do. That's what they would do.
You know, someone just mentioned this, and this is a huge sticking point for me when it comes to pharmaceuticals, and that is the fact that you have all these drug companies that run these ads on TV, and we all know
Oh
how
my God, with all
expensive
disclaimers.
marketing campaigns and advertising is. You know, and the fact too that when you start talking about the FDA and protecting their monopolies, and the reason why I say that is because this runs into the advertising thing, and I don't know if you've thought through this or not, or if you have a specific position on this, but that is the advertising of pharmaceutical drugs. I mean, and how they can take, let's say Prozac, not even tweak it, just like run it, with a different group of people with a different condition and find that it helps that condition, rename it, and then remarket it. In order to keep their patent alive and keep it from going generic.
How much truth in advertising is there?
Well, I don't think there should be any. My personal opinion is I don't think there should be any advertising for pharmaceuticals to the general public. I think that that's just wrong. I mean, it should be a medical thing. It should be a doctor thing. But I don't know if you've thought through that or not. But
I don't feel strongly about that. In fact, I think that advertising, first off, advertising gets us into all sorts of constitutional issues. Commercial advertising is protected as well, and I think it should be protected. I mean, I think the key thing though is to make sure there's truth in advertising, so that people are getting facts and not fiction. I think that's the most important part of it if you can have advertising. And so I'm not into banning advertising. I think information is information, and particularly if you have a single payer system where you have a doctor you have a relationship with, you can get information from the doctor as well. Now the problem is that the pharmaceutical companies also have relationships with the doctors too, and relationships with universities. And so most of our doctors now are taught pharmaceutical solutions.
Yeah, exactly.
In the universities that are dominated by pharmaceutical money. And so we got some serious problems in that.
Well, I mean, I think the real concern I have is when, I'm just going to but pick one of the many drugs, like Claritin. How many times a day did you see a Claritin ad come out? It's like, I think they spent over $100 million, I remember hearing, on their advertising budget. And it's larger than they spent on designing the drug, on producing the drug. I mean, if you're doubling your cost just to advertise, and that's getting passed on to the consumer, I think that's where the real problem comes in this advertising part.
No, I think we solved the single payer problem. That's only the first step. There's going to be a lot of other issues in healthcare to make healthcare working as well as it could work. And we could have a great healthcare system in this country. We have the resources to do it right, but we're not doing it right because of the corruption of our government.
Getting back to the single payer for a minute, since that was the issue, have you, in terms of your policy here, the idea that there'd be, everyone would have some health insurance, but you wouldn't, I would hope that you wouldn't require people to have, the full book,
No, here's
it would be kept very minimal.
No, not at all. Not totally opposite. Everybody would have the same health insurance. Everyone would have comprehensive, lifetime coverage. That's what it would be. We're not going to people aren't going to get no dental care. I mean, no. The idea is comprehensive, lifetime coverage. That's the goal.
Coverage of what?
For health, the whole.
This is the thing.
Well, no,
we see in
for health.
Maryland.
Problem.
I think early pointed in his last campaign, the first campaign against Townsend.
Right.
He made a pretty valid point. What you see happening in Maryland and I guess other states too is that they keep passing this legislature saying, you're requiring, more and more things to be added to everybody's health policy.
Well, that's different. That's a whole different story. Now you're still stuck in this private health insurance industry problem. And you're still stuck in that. I mean,
but it would work the same way.
I know you have the goal is comprehensive lifetime coverage for everybody. That's the goal. It's not going to be a discriminatory health policy. Health is a basic need of people, and it needs to be. You need to provide for it.
I don't really understand my question. You have, for example, people have different needs, and people have different needs at different stages in their life.
That's right.
So a healthy young man in his 20s may want less insurance than.
There's not going to be any. There's no insurance companies. We all pay taxes like we pay now, and that's part of the cost of government. It's not going. You're not going to be paying more in your 20s and your 50s or your 30s. It's not going to change you. You're going to be paying your taxes, and that's going to be just part of the cost of government. So it's not like a special. You're not going to be deciding what you want in your 20s versus your 50s.
For example, for pregnancy.
You pay for everybody. That's right. Everybody shares the burden.
Even if he's a man.
Everybody shares the burden.
So actually, what you're saying is this: what I hear you say is that in order to do what you're saying, we have to have truly good government. Because
that would certainly help.
Well, because
in fact, even to get there, you have to have good government.
Because
Yeah.
if you don't have truly good government, what you're proposing can be misused
Oh, yeah.
easily.
You know, on every.
So we have to have a real cleanup. I mean, we gotta have the complete
Well, listen,
sweep.
Lorenzo.
And I'm not against that.
Lorenzo,
Don't get me wrong.
in order to get there, you have to have a clean sweep.
Yeah.
You know, this current government is not going to do it.
No.
Look, there's just too